created a whole setup.
I did. Okay. Okay, so knock, knock. Going to wash my hands. Close the door for privacy. Hi, my name is Sarah. I'm going to be your nurse for today. Can you please state your name and date of birth? Kenton Parker's date of birth, 5'8". Kenton Parker's date of birth, 5'8". Mr. Parker's, do you have any allergies? No? Okay, and the patient is not wearing an allergy band. I'm going to verify the MR number, 7700213, 7700213. Okay. All right, so Mr. Parker's, I'm going to be doing a full head to toe assessment on you today. I'm going to start off with some vitals. So here on the monitor I have blood pressure of 172/91, heart rate of 87, O2 size 89% on 2 liters nasal cannula. So I do have a doctor's order to titrate the oxygen to reach 92% or above. So I would titrate the oxygen. I'm going to put this under your tongue for your temperature, and it reads a 98.9. Okay, Mr. Parker's, are you in any pain today? You are? Okay, so on a scale from 1 to 10, what would your pain be? A 2? Okay, where is that pain? Your ankles? Okay, does it radiate anywhere? Non-radiating? Okay, what makes it better? Tylenol? Okay, what makes it worse? Too much walking. Okay, so, do you know where you are today? Fortis Hospital? Okay, do you know what date it is today? Okay, 5/27. Okay, and do you know why you're here? Okay, your COPD, shortness of breath. Okay, so I'm gonna look in your eyes and follow the pen for me. Okay, so patient is alert and oriented ×4, and pupils are equal, round, and reactive to light, and they're also able to accommodate. Open your mouth for me. Okay, oral mucosa is pink, moist, and intact. Going to check your skin turgor, which is non-tenting. Okay, have you had a cough recently, Mr. Parker's? Yes? Okay, are you able to cough anything up? You are? Okay, and what's the color of that? Yellow. And the consistency? You said is thick? Okay, and if you could cough up anything into a little medicine cup, about how many milliliters do you think? 15? Okay. Going to inspect the chest, rises symmetrically. Okay, I forgot to take respirations, so I'm going to do respirations now. Okay, 30 seconds has gone by, and respirations are 30. Okay. I'm going to listen to 8 places on the front and 10 on the back. Okay, so respirations are even and labored. I also hear crackles in the lower lobes of his lungs. And I would listen to 10 places on the back and find the same findings. Okay, I'm going to listen to your heart. Starting with the second intercostal space to the right, which is the aortic. S1, S2 present. Second intercostal space to the left is the pulmonic. S1, S2. Third intercostal space to the left is Erb's point, S1, S2. Fourth intercostal space to the left is tricuspid, S1, S2. Fifth intercostal space mid-clavicular line is the mitral, S1, S2. I'm going to flip this over and take the apical pulse for a full minute. Okay, so I'm simulating that a full minute has gone by, and the apical pulse is 89. Okay, I'm going to feel the pulses. Brachial pulses on both sides is +2 and regular. Radial pulses on both sides is +2 and regular. Going to check capillary refill on both sides, which is less than 3 seconds. Can you squeeze my hand for me? And push down and pull up. Okay, good. Strength on the bilateral upper extremities is 5 plus 5. Again, to assess the IV site, the dressing is clean, dry, and intact. It's dated, and there's no redness, swelling, or infiltration. And I would flush the IV for check for pansy. Okay, Mr. Parkers, when was your last bowel movement? This morning. Okay, what color was it? Brown. Was there any unusual odor? No? Okay. What was the consistency? Hard? And about how much? Was it small, large, small? Okay. Going to assess the stomach, and stomach is flat and not distended. Going to listen to 4 quadrants, starting with the lower right quadrant. Vowel sounds are active. Upper right quadrant, vowel sounds are active. Upper left quadrant, vowel sounds are active. Lower left quadrant, vowel sounds are active. Okay, so I'm going to palpate, and can you tell me if you have any pain or tenderness? Lower right, no. Upper right, no. Upper left, no. And lower left. So there's no pain or tenderness when palpating. Okay. When was the last time that you urinated? 10 hours ago? Okay, about how much? 200 milliliters. What was the color? Almost brown. That is very dark. Okay. Was there any unusual smell? No? Okay. And what was the clarity? It was clear. Did you have any pain, urgency, or any frequency? You said decreased in frequency? Okay. Alright, so I'm going to assess the genitalia now. I'm just going to lift it up and take a look. There's no redness, swelling, no lesions, edema, abnormalities, discharge, or any sores noted. So I'm going to put that back down. I'm going to assess for edema, and this +3 pitting edema. I'm going to wash my hands. Put gloves on. We're going to assess the pulses. Posterior tibialis pulse is +1 regular. Dorsalis pedis pulse on both sides. Dorsalis pedis pulse on both sides is a +1 regular. I'm going to check for capillary refill. It's less than 3 seconds on both sides. And can you push down for me and pull up? And the bilateral lower extremity strength is +5. I'm going to take these off. Wash my hands. All right, Mr. Parkers, we are all finished with the head to toe. I'm just going to step over here and call the doctor, okay? I'm going to make sure before I step away that the bed is down, the rails are up, and the patient's safety is first. Okay.